I'm Dr. Malik. I want to talk about an important topic today, that is vertigo. Vertigo. V-E-R-T-I-G-O. What is vertigo? Many people come to us in the emergency department. That, sir, whenever I am trying to lie down, or whenever I am trying to sit, or whenever I am trying to stand, the whole room is moving. The whole world is moving around me. I am not moving. I am here only, but the whole world is moving, the whole room is moving around me. This is called vertigo. So you have to differentiate between vertigo and dizziness. What is dizziness? Dizziness is patient says, I feel that I am falling down. I'm feeling that I am not comfortable when I stand or sit. I feel that I have giddiness. I am falling down. This is dizziness. I am about to fall down. I have the dizziness. But vertigo is the whole world is moving, the whole room is moving. So that is the difference between. So vertigo comes with some other problems like ear problems and central, that is small brain problems, cerebellum. Cerebrum is large brain, cerebellum is small brain. Cerebellum controls your motion, your movements and your standing, everything is controlled by small brain, cerebellum. Whereas dizziness, what the patient says, I may fall down, that comes because of your low BP, or you have not taken sufficient fluids, or you have not taken sufficient fluid, hypoglycemia, etc. Your sugars are falling. That is the reason for it. So you have to differentiate between vertigo and dizziness. So vertigo has got two main reasons, peripheral and central. Peripheral is from the ear. Ear is divided into three parts: external ear, middle ear and inner ear. Mainly your motion is controlled by the inner ear. Inner ear, there is one system called vestibulocochlear system. There are three small bones also, malleus, incus, stapes, and there is a cochlear system which has got some tubes inside, semicircular canals. It's a small mechanism. There is an inner ear mechanism. Inner ear near the brain, there is a small mechanism where is a small structure which controls your total motion, and it sends this inner ear vestibulocochlear system sends signals to your cerebellum, that is small brain, that you are in motion or you are in stationary, or you are stationary, you are in motion, you are boarding a bus, etc. Everything it sends signals to the small brain, that is cerebellum. Cerebellum is the small brain, cerebrum is the large brain. So cerebellum, small brain, is concerned with your movements, and all signals go from your inner ear, vestibulocochlear system. That system sends this. So whether your vertigo is because of peripheral or central, you have to first come out of it. You must know it. So peripheral problems usually they have vomiting sensation, nausea, vomiting sensation, vomitings, and tinnitus. Ear, there is some sounds in the ear. There are some sounds in the ear, and sometimes deafness. Deafness means you are unable to. Your hearing capacity has come down. That means to say that there is something wrong with your inner ear. That's why this vertigo is coming to you. Whereas in central nervous system, if it is coming from the brain, then you will have, other signs like migraine may be one of the causes. Central migraine, migraine headache, it also presents with vertigo, and you may have some other things like cranial nerve problems like diplopia. You are seeing everything two. And one more thing is ataxia. Ataxia means you are unable to speak. You are slurring. Your speech is slurring. You are unable to walk in a straight line. All these features which are concerned with your small brain will manifest if it is central. All the cranial nerve problems like your you are seeing everything two and two, diplopia, ataxia, you are not able to speak well. There are so many things like you are not able to walk properly, etc., etc. These things are central. So how do you know this? So usually when you have some deafness or hearing problems or sounds in the ear, you go to ENT specialist. And if there is central problem, just like this migraine, diplopia, seeing double, then you go to the neurophysician, and usually any physician will send you like that, and you get an MRI done. MRI means you know that it is a scanning. It is scanning of the brain. So scanning of the small brain. So MRI, magnetic resonance imaging. It is little better than CT scan. So it gives the picture. Number one, there is one test called, one more feature is there is nystagmus. There is nystagmus. Nystagmus, you must have seen the movie Aparichitudu. In that, the hero will have eye movement horizontally. If the eye movement is horizontal, nystagmus, it is peripheral, it is eye cause. It is central cause. If the brain has got problem, your eyes at the time of this problem, vertigo, you will have horizontal movement of the eye. Whereas if it is peripheral, there will be vertical movement of the eyeball or circular movement of the eyeball. This is called head impulse test. Doctor will do a small test by asking you to see something steadily and move your head to left, right, and give a jerk, so that he can differentiate between these two things. Okay. Forget all those things. So ENT surgeons, ENT specialist will see the case, neurophysician will see the case. They will decide what you have the problem. Then what is the treatment? First, let us go to simple treatment. The thing is, usually normal treatment is we give Stemetil, chlorpromazine, that is antihistaminics. Okay, Stemetil, chlorpromazine. Stemetil is an important medication. It can be given IM, that means intramuscular, injection form or tablet form. There is some tablet called Stemetil MD, mouth dissolving tablet. Metoclopramide, Perinorm, Ondansetron, Ondem. These tablets also give you good relief. And benzodiazepines like diazepam, alprazolam, all these things, they also give good relief. And sometimes diuretics. One disease is there called Meniere's disease. Meniere's disease is inner ear. There will be some fluid. If the fluid increases, there is tension in the inner ear. This is called Meniere's disease. That can be relieved by diuretics. By giving diuretic, the patient will have twice or thrice excessive urine formation, so that you know that there is one called tablet Lasix, thiazides, there are plenty of tablets for passing urine. Okay, so the fluid will come out. So that can be done. And there are other tablets like Vertin, Stugeron, Digeron, etc. Vertin, Stugeron, Digeron. These are all the medications which relieve your problem temporarily. But you have to get evaluated whether it is central or peripheral. This is very, very important. And doctors will decide whether it is central one or peripheral one. And if it is peripheral, ENT surgeon will treat it. The ear problem, inner ear problem, then ENT surgeon will treat it. If it is central problem, definitely neurophysicians will take care of it. So it is one of